Hello, can you see and hear me? How are you women tonight? So, this is my first stream and I'm really nervous. I don't know exactly like how long I want to go for with this because it's like I kind of mentioned, it's a pretty dry topic. I'm basically just going to be going over kind of the medical components about synthetic testosterone and how it's manufactured, who manufactures it, the chemistry of it, and then some of the research that I found regarding hi Benji, regarding side effects and testing that's been done. As we all know, there is not a lot of testing out there, so I'm mostly going to be focusing on research studies that have been done on males, because there is just not a lot that has been done for females. But yeah, thank you, Michelle. This was an accident. I meant to do a trim and like keep way more of the hair, and my clippers like were misaligned or some shit, and it just got really messed up. So I went to my stylist friend and she was like, we gotta like take it all down. And I was like, okay, that sounds great. It's really hot anyway. And I'm going to try really hard not to complain about the heat because I know most of you guys are in much hotter places. But for where I live, it is actually very hot. So I'm going to be sweaty and gross and like dabbing my forehead. Thank you, Lisa Michelle. And for anyone who has been to Benji's streams, which I'm assuming is going to be most of you, kind of same rules apply. We are not going to use... Oh, yes, Benji, I do love my shorter hair. I was really self-conscious at first about my hairline, but yeah, I like it a lot more now because at this point it's like I don't have to do anything to it, which is great. What was I going to say? Yeah, if you've watched Benji's streams, you know the same rules kind of apply. Please don't use derogatory language that brings women down. Don't post, I don't know, don't just be nice to each other, be respectful. I'm not trying to tell women to be nice, but like, you know, just be respectful. You can disagree, and that's fine. So also no men allowed. If you see one, point them out, name and shame. And yeah, let's get started. So I hope you're all doing well. We're gonna have to take some deep breaths in this course, I think, because again, it's very dry, but also it's very frustrating that there is this drug out there that was initially produced and approved for marketing in 1979. And since then, it still has not been tested and approved by the FDA for use in females. It is used on females off-label, like in all cases in the United States, at least. I have not checked if that's a global thing, but I imagine it would be. But yeah, let's get started here. And I really appreciate your patience if anything happens regarding technical difficulties. I have only kind of played second fiddle on these streams, so thank you very much. All right. So I'm going to share my screen. All right. And the links are down in the description. If you're interested, there's a lot of them. And I believe there's one, I'll mention it when I come to it, that it just has like a real brief comment. It was a research study that I requested several times from the people who did this study, but I haven't heard back from them. But I did want to include what their findings were. So first off, Testosterone, generic name, testosterone cypionate injection, drug class androgens. This is a class 3 drug, so it is highly regulated. You can't obviously just buy it over the counter or get it willy-nilly, or so you would think. Other class 3 medications include lots of medications for ADHD. If you think of like opioid medications, those are also class 3. Yeah, they are. I have spent some time working in a pharmacy. They are held under lock and key. These kinds of drugs are extremely regulated. So the fact that they are given out very easily, and that you can obtain this prescription so easily is kind of astounding, because it begs the question, why is this a class 3 medication, but I can literally get it through an application on my phone? So let's look into what testosterone is. It is a prescription medicine used to treat the symptoms of impotence in males, delayed puberty in males, hormone imbalances, as well as inoperable breast cancer in women. That is an off-label use. Testosterone may be used alone or with other medications. I am going to find the more accurate black box information for you, the actual like FDA, that information is. So we will get to that. This is just their definition of testosterone. And if I speak too quickly or too slowly, please let me know. Again, I'm kind of nervous and I kind of jibber jabber when I'm nervous. So, it is not known if testosterone is safe and effective in children younger than 12 years of age. This is going to come up a few times in all of these resources. So I do think it's interesting that in in anecdotal occurrences, like if you go to like r/dtrans on Reddit, or if you are on Twitter and talking within the trans community, you will probably find someone who was prescribed testosterone at a fairly young age. I doubt at 12 years old, to be honest. I know that's kind of a contentious topic. A lot of people who are on the more gender critical side are kind of like, they're giving it to babies, kind of thing. And I get that, like, they're still children. Like, I'm not trying to say like 2 years makes all the difference. That's not my point. But my point is that as far as like 12 and under, probably hasn't been done. But regardless, if I can interject my own personal opinion here, I don't think anyone, for one, I don't think anyone should be on this medication, but also I don't think anyone should be prescribed this medication who is under the age of 25. And we can go into that a little bit more at some point. Yeah, it's not been tested, as far as I know, on anyone 12 or under. And I haven't found many research studies regarding teens. So I'm sure there's something out there, and it's probably incredibly biased. Yeah, I'm not going to touch too much more on the age thing, because that's really all I have to say. So this site, which rxlist.com, is a really great resource if you have a medication and say, like, I always like throw out the paper. Well, I don't always. I tend to keep it more these days, but a lot of times, like if I have a medication refill of something I've been on a long time, I'll just like happen to throw out the paperwork, because I'll be like, oh, everything's fine. I've been on this drug for 12 months or whatever. And then, if something bad happens, you have to like go scrambling. So this is a really good website to use, I think, to find known side effects and interactions and things like that. Possible side effects of testosterone. And once again, I will repeat, this is all just male side effects. And as we all know, Male bodies are different than female bodies. So one can only imagine that an endocrine system that is not equipped to handle the amount of synthetic testosterone that a male body might be able to adapt to, um, that endocrine system is probably not going to deal with any of this stuff very well, and is probably going to take some of this and run with it and have even worse symptoms than these things. But that's kind of conjecture. Chest pain or pressure, pain spreading to your jaw or shoulder, shortness of breath, breathing problems at night, sleep apnea, swelling in your ankles or feet, rapid weight gain, convulsions, seizure, unusual changes in mood or behavior, increased or ongoing erection of the penis. Sorry, I said penis. Ejaculation problems, decreased amount of semen. Sorry, I said semen. Decrease in testicle size, pain or difficult urination, increased urination at night, loss of bladder control, stomach pain, constipation, increased thirst or urination, muscle pain or weakness, joint pain, confusion, feeling tired or restless, nausea, weakness, tingling feeling, irregular heartbeats, loss of movement, right-sided upper stomach pain, vomiting, loss of appetite, dark urine, yellowing of the eyes or skin, jaundice, welling, warmth, or redness in an arm or leg, sudden cough, wheezing, rapid breathing, coughing up blood, sudden numbness, especially on one side of your body, severe headache, slurred speech, and balance problems. And possible side effects may cause. These are all things that at one point someone experienced on this medication. And I think that it's safe to say more than one person experienced each of these issues, because they wouldn't list something if only one person experienced something, right? Like, it doesn't make sense. And this drug, again, has been out for quite a while, since 1979. So I feel like at this point they have enough people that the negative side effects in males are becoming very apparent. So let's look down here. Most common side effects: acne, changes in your menstrual periods. I don't know why they added this. I think, yeah, they updated this recently. Last time that I had this open, it hadn't been updated since, like, I think 2018 or 2019, actually. So it's interesting that they recently updated it to include menstrual periods. But they're still using the word male, and that's just really transphobic of them. So let's see here. Male pattern hair growth on the chin or chest, hoarse or deepened voice, and enlarged clitoris. These are not all the possible side effects of depo-testosterone. For more information, ask your doctor or pharmacist. You may report side effects to the FDA. So I am conflicted. I have not been on depo-testosterone since 2017. And, a lot of my health problems did not really surface until once I started to go off of it. And I think that's a really important point. There is something called loss of follow-up. And it's kind of what it sounds like. When someone falls out of a specialty medical care, their doctor no longer has knowledge about if something is going right or wrong for them. Now, in some cases, like, say you beat cancer, like, and it's been so long, like, maybe you just don't want to keep going. I don't know. I haven't experienced that. So there might be certain cases where you go a while without checking and it's okay. But for a drug like this that is so experimental, I feel like more there should be more availability, and more reaching out, more initiative put into finding people who have been on this drug. Um, and Yeah, Benji makes a good point. A lot of these are effects that trans-identified females who are on testosterone expect or want. Um, I think it's also interesting to say, um, for a lot of the like chest pains, tightness, trouble breathing, those things. A lot of the women who take testosterone are also wearing chest binders. And so I know, at least from my own experience, and from some information that was divulged to me in confidence, that even though it's quieted in the media, most trans-identified females who wear chest binders, they do understand that they are feeling pain at some point and difficulty breathing at some point. They're not just like so high on the euphoria that they're ignoring it. At some point, she's going to acknowledge that and probably shove it off, honestly. Probably just be like, okay, well, whatever. Like, as long as my chest is flat, that's all that matters. It might not be only that your chest is hurting, or that you're having trouble breathing due to wearing too tight a binder. It might be that in combination with the fact that you are taking this medication. And so I think that's also something that needs to be talked about more often with doctors. I don't have numbers. I am going to try to find some statistics at some point regarding substance use, but at least up until recently, a lot of trans-identified females smoke cigarettes, or smoke a lot of marijuana. And so those things can add to chest pains and difficulty breathing. So what I'm trying to say is, like, this is a major side effect of this medication, and it can be completely disregarded, and like no one will understand or know, or attribute that side effect to this drug. So I wonder too about some of these other side effects, and if they are just kind of swept under the rug as like, oh, it's just your body adjusting, or it's something that they want, or even to a point where I think a lot of the side effects, if a trans-identified female experiences it to some degree, she's in a mindset of not thinking about her prolonged health. She's thinking about her immediate health. And so she's not going to think about how she might need to stop this medication in order to be a healthier person, because, I mean, this drug has addictive properties, and then there is also a psychological addiction to it. And that's something that more gender critical people, I think, need to understand, is, I've heard in conversation, some women get really upset that other women are not detransitioning. And this is something that needs to be talked about more often, is there's a lot more to detransitioning than just quitting cold turkey and loving yourself and going back to it. We've talked so often about the emotional process, and about, the trauma, and having to acknowledge the harm you've done to yourself. But there's also like the physical dependence. And when you go off of this medication, like all hell breaks loose, at least for like a month or two, while you are dealing with, your reproductive system hopefully waking back up, assuming that you've maintained, your ovaries and your uterus. And then also additionally to that, your metabolism changes, your mood changes, your sleep changes. I mean, like, my taste changed, which is really not that bad of a side effect. But I'm just trying to say that the physical things that happen when you go off of this medication are immense, and they can be short term, or they can be over the span of a couple of years. I am still learning some of the physical damages that I have done to my own body. So I think it's important for women who are not detransitioned, who are in conversation with detransitioners, or who are in conversation with trans-identified females, to just kind of at least internally acknowledge that, like, this is like a multi-tiered process, right, of going off of this. Oh, Lisa Michelle, my taste here, let me show my preferences, I should say. So like I used to, an example, I used to hate like olives, and now that I'm off of testosterone, I love olives. So that's like just weird, but yeah, again, not a huge side effect or anything, but I do think that it's interesting at least to see all of the minute or large and troubling side effects that can occur and span for long term. Okay, stop ranting. Let's move on. So the chemical name for testosterone cypionate, and I apologize if I'm saying that incorrectly, is androst 4N31. And there's some more to it there, but I'm going to shorten that. And this, you'll see, is its molecular structure, or the formula structure. It's available in two strengths, 100 milligrams and 200 milligrams. Thank you, guys. Sorry, guys. I was discussing this with Carol the other day. Saying the word guys is a bad habit of mine. It's kind of like a West Coast thing, and I don't mean to excuse it. It's just I don't really realize when I say it, so I'm sorry. So here is what the solution contains. So it's pretty straightforward. It's mostly testosterone cypionate, and then there's like a little benzyl benzoate, and then cottonseed oil. I've heard, or I did hear when I was taking this drug, that there was an alternative to the cottonseed oil, I believe, but I'm not 100% sure about that, and I don't know what it is. That's the carrier for the testosterone cypionate. So I don't know exactly what the alternative is, if there is one. I do know it was an issue for a few of them, a few of the trans-identified females that I knew, where they found out they were somehow allergic to cottonseed oil, and they found out because they took this drug and had a severe allergic reaction. So it's yeah, JL, I don't know what the etymology of the word dude is. That would be interesting. Yeah, I say all of them. I say dude, I say bruh. I say dude, bro. Not, I usually use that in a derogatory way, though. Let's see. So, yeah, that's pretty much the generic of what's in it. Some indications and dosage. So, again, this is indicated only as hormone replacement therapy in males. It is not under the FDA approved for use in females, even though it is used. Now, I will say, I know I talk a lot about how it's used off label and how that's sketchy as fuck. But I also want to highlight that, yes, there are a lot of medications out there that are used off label and that work very well off label for what they are prescribed for. However, let us be clear. There is a difference, I think, between using a medication off label for something, especially for something related, like a lot of mental health medications are used for similar mental health things. So might be used as an antidepressant, but then it could also be used to treat bipolar, because that's kind of related. So there's that. But in general, I think there's a difference between that or using a drug that has been tested for off-label use, and just for whatever reason not gotten full FDA, yes, this is a drug to give to people. And a drug that, like testosterone, has not had any published research, realistically, that's scientific, and that is not funded by the very people who profit off of it. And in having that drug prescribed off label and not having that regarded, that was a really bad run-on sentence, and I'm sorry. Ziggy is very quirky right now because it's hot, and when it's hot, green cheek conures, they tend to associate heat with summer, which is their mating season. So he's angry and humping a lot of stuff. So if you hear him squawking or ringing his bell or whatever, that's probably what it is. Hi, Dewey Lou. I hope that you're ventilating your shower. Make sure you're getting some oxygen in you. Okay. So, it is, this drug is indicated for primary hypogonadism, which is congenital or acquired testicular failure, and hypogonadropic, I can't say that word very well, hypogonadism. So LHRH deficiency, pituitary hypothalamic injury from tumors, trauma, or radiation. So basically, this drug is primarily used in males who are having testicular failure for a number of reasons, and or have a pituitary issue where they cannot produce and or process testosterone properly due to things like cancer or radiation treatment for cancer. So a lot of the times, males who are on this drug are on it due to things like prostate cancer. So a lot of the research has been done on that. So just, I guess, keep that in mind. Dosage and administration. Oh, I love this part. Prior to initiating testosterone cypionate, confirm the diagnosis of hypogonadism by ensuring that serum testosterone concentrations have been measured in the morning on at least 2 separate days, and that these serum testosterone concentrations are below the normal range. So they are for males who are still able to produce a higher amount of natural testosterone, just not enough due to medical issues. They are prescribing them below the normal range. Now, I did not think to bring up what the normal range looks like for males. I also don't know what a normal range is considered for a trans-identified female. I've looked for that information. I don't have it. If anyone has that info, that would be awesome. Or like even if it's just a list of women who have taken testosterone and what their doses have been or their testosterone levels have been. I know Carol has mentioned what her level was before. I wish I could remember my level. I might have that information somewhere, actually. I'll have to check. It did change because I was on it for so long, and it usually will change for trans-identified females. You'll usually continue to go up and up. But yeah, Lisa Michelle says, I believe they try to get trans-identified females up to male levels. They do. It's I don't know if that's still a current thing, is the thing, Lisa Michelle, because I've been out of it for so long. Oh, awesome. Thank you. Thank you so much for this information. Yes. Anyway, yeah, when I was taking testosterone, they didn't even check my blood work first. My doctor, I mean, granted, this was the days of doctors being blunt and saying, we are experimenting on you. Fantastic. I love being a guinea pig. So my doctor was pretty open about the fact that she had no fucking idea what she was doing, but she was really optimistic about it. And I was kind of, in the middle of a crisis. So I just went along with it, and she was the professional. So I trusted her, which I have learned not to do all the time. Yeah, at the time when I started, she did not do blood work at first. What she did was she checked like my height and my weight and my age, and checked the normal range for a male with my height, weight, and age, and was like, cool, that's what we're going to go for. That's what we're going to try to accomplish. Yeah, it was way too much. I'm sorry, I'm blanking on the numbers right now. I can absolutely get this information because I recorded it in another video a long time ago. But at one point, I discovered that I eventually got up to, well, very quickly got up to a point where I was taking 3 times the amount that a lot of other women have taken. And my doctor was just going to have me keep going. Another thing to point out is this is part of why they, oh, damn, Carol. Oh, damn. Oh, your poor endocrine system. Your poor thyroid. That's not okay. That's not okay. Oof. Yeah. And also I want to say too, I don't know my levels. So there's the levels of what you have, in your system for your testosterone level and your estrogen level. Females have both, males have both, but in vastly different quantities. I don't know my levels because that was not frequently checked. Even though I requested it, it was very seldom checked. And also my insurance would not cover the blood work. So I would have to pay out of pocket to get that lab work done. It was a whole mess. Trans healthcare is not healthcare. I don't believe that kind of situation has changed either. I think a lot of this is just doctors throwing everything at the wall and seeing what sticks. And they feel encouraged by their patient that if they show their patient a high number, their patient's going to be happier. So I don't know what my level of testosterone was, but I do remember at one point the syringe was 2.75. And so I don't know what that would be. And I was taking that once or twice a week, depending, because at one point I was doing it twice a week. So anyway, let's get back. I'm sorry, I'm just reading the comments. All right. So, yeah, suggested dosage varies depending on age and the diagnosis of the individual patient. Dosage is adjusted according to the patient's response and the appearance of adverse reactions. This drug is taken intramuscular. So, ass or thigh, take your pick. don't know. Oh, yeah, you can also, I believe, do it in your stomach, if you have enough fat there. I had always do it in my ass, so that was fun. And yeah, I still have a couple of scars there from some bad times. Okay. I'm sorry, y'all. I'm just like still really anxious, and I don't know why, because I talk to you guys all the time, and this is stupid. Okay, so this is some more information on depot testosterone. Testosterone does come in different forms. So there is, oh, Myron, don't worry, you're not that late. I've just been like ranting. Depot testosterone is a form. The depot insinuates injection form, and something to do with the construction or formulation of it. The other forms that I'm aware of are the gel form, which you usually place, you'll put the gel around like your pelvic area, or I think you can also put it on your inner thighs. And thank you, a possible person. I feel like I am. It's weird because like I usually have like Benji to stare at and like riff with and shit. So I'm just like talking a bunch at myself. And oh, Myron. Okay. I'll also try to talk slower. Okay. So then maybe we'll meet. Yeah. Okay. What was I saying? Oh, another form of testosterone. I think there is, correct me if I'm wrong, Carol, but I believe, or anyone who knows, I believe there is a patch. I'm not sure how available that is. I know there's an estrogen patch, but I think there's a testosterone patch as well. But I believe also that the quantity in it isn't used for women who are transitioning, because it's low. But I'm not 100% sure on that. There also at one point was an implant that was being tested. I had a friend who was doing a trial for it. And I think they got approved. I'm pretty sure. But things like implants in general, implants that release medication gradually, for whatever the fuck reason, insurance won't cover that stuff. So I knew this one woman who was in the trial for it, and I haven't known a single other woman who takes testosterone who was on it. I do think it's really interesting that there are all these other forms, and I know like it was mentioned earlier in the comments, like non-binary women are microdosing it, and I mean like lesbians are microdosing it and all this stuff. So I know they're probably on the gel more likely, because the gel is usually a lower dose and usually a little easier to control. And it doesn't hit you quite as hard. It's more gradual. But regardless, like this like fetishization of like injection drugs, like again, it's not intravenous, but like still like you're fucking like sticking a syringe in your ass or in your thigh or in your stomach and like associating it with euphoria and sometimes like an orgasmic like feeling. Like that's kind of messed up, right? Like I know we're kind of like all in agreement that there's a lot about this that's messed up, but like that like really specific thing, I'm just like I look back and I think about like how I like had this like ceremony and how so many trans identified females I know, like their first shot was like, oh, it's such a big deal and they have to do it right away and all this stuff. Oh, thanks, Aqua. I hope you take care. I hope it's cool wherever you are. Thank you for stopping by. I don't know why, but I feel like my Minnesota is coming out a little bit. Um, yeah, anyway, I look back on like the ritual of everything, and we're we're definitely like creatures of ritual in addition to habit, right? Like uh anything that we consider a big life change, we're going to mark that in our minds and make a big deal about it. But in this case, it's just so weird. And I could go on and on about the way that like our culture uh, reacts to medication in terms of like emotion and like ritual and things like that, and how um, the fact that like medication is advertised to us. There are commercials that advertise drugs to us. um, I don't know. I mean, I think there can be some benefit to that, because sometimes, maybe you'll hear about a medication that could help you and you haven't heard about before. Um, but it's also, I think it's mostly bad, is my opinion. Maybe you guys have a different opinion, and that's okay too. Um, but anyway, a lot of times it's these very, very young, naive women who have like mental health issues. A lot of the women that I knew were very like anti-medication and like chemical free and stuff, kind of what you would consider like hippies and stuff. Um, and it just seems so strange to like be putting this in your body and to like just obsess and love the act of putting a needle in your body to inject something that you don't need to survive. But I understand they think they need it. So, all right, back to the resource. I'm going to skip a little bit of this. This is a very long document. Oh, no, this isn't the long document. This is a shorter document. Sorry. But I'm going to skip a little bit ahead. So this is the FDA label. So this is, here, let me show you again. So this right here means class 3. If you see a box of depot testosterone, you'll see this marked on there along with some letters and numbers to indicate the pharmaceutical company and basically where it belongs in a pharmacy. But this is the FDA approved label for depot testosterone. Could not say it better myself. Yep. All right. Where is it? Let's see. Actually, I'm gonna move my box. Let's see if this works. There we go. I like that better. That looks better. Yeah, it's yes, Carol, get some ice cream, please. Eat lots and lots. I think it's really, I don't know. There's so much cognitive dissonance, and I feel like that phrase is overused, especially by me. but it's true. It's like, I'm sorry, but it's crazy. It's so strange, and so unhealthy. There's definitely, I am the kind of person where I believe that there are situations where medication is 100% necessary for someone to either survive a disease, obviously, or to maintain their mental health. I am a person where I am, for better or worse, dependent on medication to keep me from hurting myself or ending my life. And so far, it has been successful, and I have found a medication that I've been on for a very long time. It's a low dose, and there's no contraindications that I'm concerned about. And I have not noticed any health issues. And it's a drug that has been tested a lot. So that is, something to keep in mind, that I think my personal opinion is that there are medications that you have to take for certain things, like even mental health issues. That being said, the way that we, not we, the way that they have framed this as a medication that you have to have or you will die. Because they say, if you don't transition, you will end your life. But what they seem to emphasize that it's like out of your control, right? So it's less like you're doing the action, and it's more like this is inevitable. This is going to happen. And then to top it off, there's also the comments suggesting that if you don't do it, someone else will do it because they're transphobic, which doesn't make sense to me, but whatever. So you have to take this drug or you will die. And your discomfort cannot go away without this drug. But you don't try anything else. You go straight for the drug. You don't try anything that is less invasive. You don't try anything that is maybe steps towards processing the psychological issues. And again, this is all stuff I know we've talked about plenty of times. I'm just kind of like spitballing here. If you don't do the rituals, you got to light the candles, say your prayers to Marsha P. Johnson, and then you're ready. Exactly. We've tried nothing and we're out of ideas. Like someone walks in with this clear mental health disturbance, and the number one step is, oh, okay, let's put you on this extreme drug that's never been tested on females. It's ridiculous. I mean, even in serious cases of things like psychosis, medication is done in steps. You don't put someone I don't know, maybe they are doing a step method now. I was put on a medication, or the amount that was quick to get me to a level that my doctor thought was normal for a male of my age, weight, height. So that was like a high concentration. And it was a lot. And it was like the same as like other women who were on testosterone for a number of years. It wasn't a step process. It was like, bam, you're right into it. Go big or go home. And so like antipsychotics, you usually, in severe cases, they might give you like a tranquilizer or something to get you calm, and so you're not going to hurt yourself or hurt others. But that's circumstantial. They're not going to give you the max dose of anything. They're going to step you up and see what works. Oh, okay. Well, to be honest, I'm glad to hear that. Because I again, I don't know, I don't remember when you started transition, but when I was doing it, again, it was very experimental. So I think they were just kind of just throwing shit to the wind and saying like, let's hope it works, and works really fast so you don't hurt yourself. Because you're definitely gonna hurt yourself. Well, that was the hurting myself. Okay. So, oops. Okay. Shit. I got too many tabs and I closed out of it. Let me pull that up again. 1 second. There we go. Okay. So, yeah, I'm going to skip through some of this. A lot of this is kind of medical terminology, which, I would recommend you look through. However, again, a lot of this is regarding male anatomy. So it's not super applicable. But let's see here. The half-life of testosterone cypionate is, when injected intramuscularly, is approximately 8 days. So I think it's interesting that they will occasionally have you on a dosage over a span of 2 weeks. But I don't really know why they do that. I don't know why they choose to dose it out a little differently, but yeah, about 90% of a dose of testosterone is excreted in the urine. So that is to say about 90% of testosterone is being processed and gone through all of your organs and not absorbed. But once again, it's hard to say for sure because this is based on males and not females. Indications and usage. Under contraindications. So for anyone who doesn't know, contraindication is someone who should not be taking this medication, like having something that would counteract and make be made worse by this medication. Known hypersensitivity to the drug. Well, you're gonna find out one way or another. Males with carcinoma of the breast. Males with known or suspected carcinoma of the prostate gland. Women who are or may become pregnant. Patients with serious cardiac, hepatic, or renal disease. A lot of trans people drink. A lot of trans people drink and use illegal substances. And I am not here to pass judgment on them for that, because I, for the longest time, partook in a lot of that myself. And I understand that if you are in a mental health crisis, you're going to be reaching for a bottle of whatever will make you feel stable. I get that. That being said, doctors don't really seem to give a shit if you are like an alcoholic, or if you are using lots of drugs. And I mean, to be fair, they can't exactly they can't exactly force you to be honest with them, right? So you could just lie. You could just be like, yeah, I have a drink, one drink on the weekends, and really you're having 3 drinks a night. But that being said, I do think it could be beneficial to do what tests can be done to check renal function of females who are going on this drug. Because at least from my personal experience and from personal experiences of some other women, we experienced renal failure due to this drug. And I'm going to probably say this throughout this whole video, but I don't understand why you wouldn't prevent issues except for the fact that it benefits you, that you can make a profit by giving somebody something that is going to actually make them more sick, and then they're going to have to come back to you for more help. And I'm sorry, I know it sounds really conspiracy theorist, but for any doctor who's conscious of any of this stuff, which they fucking should be, because this is, again, the FDA label. This is readily available to anybody. You know, for any doctor prescribing this to females and to males, I feel like it should be done. You know, everything should be done to prevent long-term damage. But it's not, because society or whatever the fuck. So let's move on. Okay. Sorry. Iced coffee gets me through the day. All right. Warnings, my favorite parts. Oh God, can I say this word? Hypercalcemia may occur in immobilized patients. If this occurs, the drug should be discontinued. I don't know what how hypercalcemia is. It sounds related to bone health, but I apologize, I don't know what that is. Prolonged use of high doses of androgens, principally the 17A alkyl androgens, has been associated with development of hepatic adenoma. I can't say adenomas. I can't say that word. I'm so sorry. It's been a long day. Hepatocellular carcinoma and peliosys hepatis, all potentially life-threatening complications. So, high doses of androgens can cause these things. We read earlier that in males who are prescribed this for very serious reasons, they are given a lower dose than normal. So why is that not the standard for giving it to females who have a completely different endocrine system and whose endocrine system cannot support a synthetic testosterone at a high level? Don't know. Geriatric patients treated with androgens may be at an increased risk of developing prostate hypertrophy and prostatic carcinoma, although conclusive evidence to support this concept is lacking. I think it's really interesting that I haven't really found any information on women who are on testosterone past like the age of 50. I mean, I guess like at some point they must stop it, right? Or go down to like such a minimal dose, but like I'm not really sure what goes on there. Again, if any of you women have information about older women who are on testosterone, I would love to know that information, whether it's anecdotal or research based. But it worries me a lot. Additionally, it worries me to think of any woman who starts testosterone at, say, the age of 15 and is still taking this drug into her 50s or 60s, because like this drug, you have to like consistently go up and up in order to like see any change. Oh yes, thank you. Sorry, JL. JL is defining these words. Thank you very much. I appreciate it. I should have gotten the Google definitions for you all. Sorry, I'm reading the comments. Yeah. That girl says, does it seem like the docs just don't know and are placating? And GNC Centric says, no, they literally just say, don't worry about it. And you need the tea. It's your medicine. Mm-hmm. Mm-hmm. Yeah. Yeah. It's your cure. Okay. There have been post-marketing reports of venous thromboembolic events, embolism, including deep vein thrombosis, DVT, and pulmonary embolism, PE, in patients using testosterone products such as testosterone cypionate. I'm sure you're all aware because pretty much everyone who's been here knows all my bullshit. But for anyone who doesn't know, I shortly after stopping depot testosterone, I experienced 3 consecutive mini strokes due to pulmonary embolism. The embolism eventually like dissipated. You can survive a pulmonary embolism, but it's extremely dangerous. If it moves to your lung, it's bad. It's real bad. Deep vein thrombosis is also kind of it usually happens in the lower leg, and it's a sign of things to come. Usually there is swelling, discoloration, numbness, things like that. A lot of women who are on depot testosterone will experience random pains. As we kind of mentioned with the chest pains, they will experience some like leg cramps and leg pains, as well as other things that I will go into later. And yes. Yeah. But what was I going to say? A lot of these women also have other health issues that come up. One issue is diabetes. Becoming pre-diabetic or fully diabetic is not uncommon with women who take depot testosterone. And I think it's important to note, like most women that I know of who take depot testosterone, they don't see a nutritionist, and there's no real monitoring or other preventive care for diabetes. I was very fortunate that that was not something I came close to experiencing that I know of. But it's definitely like a prominent thing within that community. Oh my gosh, guys, I am like so gross right now. It is too hot. Okay. But anyway, that's all to say that like women who are experiencing diabetes might have or who are pre-diabetic might have leg swelling due to that, or might have leg swelling due to deep vein thrombosis. It's not always easy with a patient's eyes to see the difference. So that's the point I was trying to make. Evaluate patients who report symptoms of pain, edema, warmth, and erythema, or erythema in the lower extremity for DVT, and those who present with acute shortness of breath for PE. If a venous thrombotic event is suspected, discontinue treatment with testosterone cypionate and initiate appropriate workup and management. Edema with or without congestive heart failure may be a serious complication in patients with pre-existing cardiac, renal, or hepatic disease. Gynecomastia. Let's see. So, androgen therapy should be used cautiously in healthy males with delayed puberty. The effect on bone maturation should be monitored by assessing bone age of the wrist and hand every 6 months. So they're acknowledging that androgen therapy affects bone health. Now, of course, in someone who has delayed puberty, their bone health is going to be particularly fragile. But that being said, I think it's important to understand that they are like bringing this up, that this drug can weaken bone health. This drug has not been shown to be safe and effective for the enhancement of athletic performance because of the potential risk of serious adverse health effects. This drug should not be used for such purpose. So yeah, they are saying it's not going to give you an advantage when it comes to athletics, which I kind of agree with, to be honest. I think that there's a lot of people out there who believe that trans-identified females in athletics have an advantage, just like trans-identified males have an advantage in women's sports. I disagree with that. And some of that reasoning is things like deteriorating bone health. Like, for fuck's sake, like, okay, so what, you're gonna like, run a marathon or whatever the fuck, and you're working with like depleted like hip bone, all that. It's just like it seems interesting to me that like some people are trying to argue that it's the same, that it's going to be an advantage for females the way it is for males, and I don't think that's the case. Testosterone is not really the only drug that affects muscular development, so I think it needs to be taken into account that a female who takes depo testosterone is very unlikely to actually have an advantage. She might, to some degree. More than likely, what I think is going on is if she does end up having an advantage, it's something to do with her metabolism changing and having more energy to work out than it is actually the testosterone making her muscles happen, if that makes sense. But yeah, that's my theory. And please feel welcome to disagree. So, precautions. We're going to get through this. We're going to get through all of this boring ass bullshit. And then we're going to get to some of the research where it's like, how the fuck are we prescribing this? I promise. I know this is super boring. Patients with benign prostatic hypertrophy may develop acute urethral obstruction. You might not be able to pee. Priapism or excessive sexual stimulation may develop. Oligospermia may occur after prolonged administration or excessive dosage. If any of these effects appear, the androgen should be stopped, and if restarted, a lower dosage should be utilized. So let's see here. Patients should be instructed to report any of the following: nausea, vomiting, changes in skin color, ankle swelling, too frequent or persistent erections of the penis. Well, no trans-identified female is going to be reporting any of that. Or at least it's very unlikely. Laboratory tests: hemoglobin and hematocrit levels to detect polycythemia should be checked periodically in patients receiving long-term androgen administration. So once again, your blood levels should be checked. All the blood work, all the labs, all that should be checked regularly. It is not. Serum cholesterol may increase during androgen therapy. It might interfere or interact with anticoagulants. I don't know what this drug is. Oxyfenbutazone. I don't know what that is. In diabetic patients, the metabolic effects of androgens may decrease blood glucose and therefore insulin requirements. So it might help with diabetes, or it might cause diabetes. I've seen both theories. So in this case too, this is once again in males, so it's hard to say. So It says here there is no clinical evidence of thyroid dysfunction. I do think that it's safe to say that thyroid dysfunction is much more likely if you are a female taking this, especially if you're taking a higher dose than, how do this, like, if you're taking a higher than minimum dose, it seems likely that you're going to have thyroid dysfunction. It's been tested on mice and rats. Awesome. And here they mentioned the implantation. The implant induced cervical uterine tumors in mice, which metastasized in some cases. Literally caused cancer, but that's cool. There is suggestive evidence that injection of testosterone into some strains of female mice increases their susceptibility to hepatoma. Testosterone is also known to increase the number of tumors and decrease the degree of differentiation of chemically induced carcinomas of the liver in rats. So it might be helpful for liver cancer, but it might cause you cervical or uterine cancer. So. And once again, this is all the information that comes in the packaging with the medication. I'm going to check the comments real quick. This is interesting. I don't think I have anything that discusses this now. But I do believe I've read something about it. I'll have to double check and get back to you. Oh, yeah, that is a good point. That is a good point. So it can change your absorption of oxygen. Yeah, I think this is also a really interesting point to be made, because like I have had a hysterectomy and have since stopped exercising very much at the request of my doctor because I had a prolapse after just going back to work too soon, and like lifting like 30 or 40 pounds a day was enough. So I think that's part of it too, is, you know, if you're talking about athletic advantages, like y'all are in the comments, like, I think, you know, I guess maybe a trans-identified female might have advantage then of, if she is only taking testosterone and doesn't have surgeries. So yeah, I mean, maybe I'm wrong. Maybe I need to be corrected on that. But also, like, how long is she going to have that advantage for? Because the peer pressure in the community is, you know, get yourself cut up to pieces as quick as possible. So here's to say. Anyway, I appreciate the conversation. This is very important information. We must answer this at all costs. Very, very good question. What is going on with the clit? So, yeah, it's animal data, and there are rare reports of hepatocellular carcinoma in patients receiving long-term therapy with androgens in high doses. Withdrawal of the drugs did not lead to regression of the tumors in all cases. Geriatric patients treated with androgens may be at an increased risk of developing prostatic hypertrophy and prostatic carcinoma, although conclusive evidence to support this concept is lacking. So pregnancy, category X, contraindications. We already saw that part. Do not give it to pregnant women or women who might become pregnant. which is really interesting considering how many trans-identified females are in partnership with trans-identified males or just males in general. And my guess is most of them are not going to be on a birth control because a lot of times the birth control is going to be counterintuitive to the testosterone. So yeah, it's interesting. I don't know numbers on the risk of pregnancy, but I do wonder, because I've known a number of trans-identified females who ended up getting pregnant after they had been taking testosterone for a number of years. I wonder, like, how long are doctors suggesting they stay off of it, and like, how long does it actually stay in your system? Like, we saw the like half-life is 8 days, but like realistically, like, what has it done to your body? Oh, here we go. All right. Facts. All right. Yeah. Yeah. It's weird how many trans-identified females I've known who, like, during their transition, like in like peer therapy groups and whatnot, like they have discussed like how they want to get over their discomfort with being pregnant because they like really want to be a dad. And there's just so much fucked up with that. Like, first of all, please adopt. Second of all, like, if you're uncomfortable being pregnant, you're going to have to live with that for 9 months. Like, why would you do that to yourself? That seems so strange and such a weird thing to like force yourself to get over it. And then also, like, who's calling the shots? Like, if assuming these people are in, or these women are in relationships, like, is it their partner who's deciding that this trans-identified female is the one who's going to carry a child, or is it the trans-identified female who's like imparting on herself all of this expectation? All right. Thank you, JL. Really like that. They're always very quick to finding information. I appreciate that. Okay. Nursing mothers. It is not recommended for nursing mothers. So again, beyond the 9 months of carrying a child, if you start testosterone while you're nursing, like, is that a thing? I don't remember, or I didn't ask the trans-identified females that I knew who had carried children if they started testosterone while they were still nursing, but that could be quite a while. So I wonder, like, do any of you women know of any trans-identified females who started testosterone while they were nursing? And like, what happens? I mean, like, I've seen it talked about with trans-identified males who are on estrogen and then they nurse. I don't really want to know what is going on there, to be honest. But I sincerely doubt that there is nutritional substance to whatever they are producing. So I wonder how, because we know that like lots of things get passed through lactation. So I don't know. I think it's interesting. All right, give me one heartbeat, please. Let me see. All right. So, boom. Clitoral priapism. let's talk about it for a minute then, because I have not talked about this before. A rare condition presenting as a cause of vulvar pain. Priapism of the clitoris is a rare condition associated with prolonged erection of the clitoris, causing engorgement, swelling, and pain to the clitoris and immediate adjacent area. Guys at home, if you are detrans, raise your hand if you've had this. It sucks. It's horrible. Like, you don't want to fucking sit down, but you can't stand up. Everything that moves in that area, walking hurts. Everything is raw and sensitive, and it's just disgusting and uncomfortable, and you can't make it stop. And everyone around you is talking about how, like, big their trans dick is or whatever, and you're just like, no, but it hurts. It's terrible. A 47-year-old woman presented complaining of vulvar and clitoral pain. Self-reported findings of a swollen and tender clitoris had been confirmed by physical examination during an episode of priapism. Otherwise, there were no abnormal findings on routine evaluation. The history and findings of prolonged clitoral swelling, tenderness, and pain of the clitoris and adjacent area were considered consistent with clitoral priapism and discovered to be attributed to the use of trazodone hydrochloride. I've been on that medication temporarily. A heterocyclic antidepressant. The patient was initially treated with imipramine hydrochloride. However, it was the withdrawal of the medication instigating that condition that was the focal point in its management. No, I'm not going to show. I'm going to try to. I probably won't show genitals. I won't show penises. That's the best promise I can make you. Conclusion. Priapism of the clitoris is a condition that may develop during therapy with certain medications, specifically those possessing a strong alpha adrenergic blockade. Please make fun of me for my pronunciations in the comments. Conditions altering blood flow to the clitoris may also predispose to developing this condition. Familiarity with this condition and a high index of suspicion are paramount in establishing a diagnosis. And here is our citations. Interesting. Yeah, I've read some things about penile priapism. And I think I read a little bit about clitoral priapism, but I hadn't actually read something like this. So thank you very much to JL and to GNC Centric for sending this to me. Okay. I need to take a brief intermission. I know, right? Like, fuck me. Like, damn. But I mean, I read so many medical textbooks for fun. I should probably know how to say these things. No, Carol. No. No. Go to the hub if you want to see that garbage. Jeez. Freaking pervert. Okay. I need to take a brief intermission. I don't really, let me see. Do you guys mind if I just like leave this up and just do my thing? Well, yeah, I'm going to mute my mic. Okay. Okay. Oh my God, it's Gay. I can't believe Gay is here. Thank you. Thank you so much for coming. This is amazing. You're like a hero. Awesome. Okay. Yes, I have bird friend. Because I don't know. Maybe we'll drive up the lakes. Yeah, there should be hold music, Carol. I'm sorry. Yeah, I'm gonna try and figure out like graphics and shit like that. I would love it if I had a friend who could draw, who or make digital art or some shit, because I can't do any of that. I tried to do some digital art like in the middle of the night the other night, and it was bad, y'all. So I am not a visual artist in terms of that. So yeah. Anyway, yes, let's get back to things. All right. Thank you for the intermission. It will probably not be the only one if I continue this stream for very much longer because I have bladder issues. Thank you, endometriosis. Right? Yeah. All right. So that was clitoral priapism that we were discussing for those who are just now joining. We are talking about testosterone and its effects on females, but mostly males, because of course there is not very much research or data available on females. Okay, let me get my screen going. All right. Oh, thank you, Anung. You can subscribe if you want. I'm gonna try to be more more prominent about doing this, but I can't make promises right now. My life is like really hectic, which it kind of always is. So I don't really have an excuse, honestly, at this point. I just decided to do this stream last minute anyway. So yes, I know you're very horny, so you want to play with things. This is mine. Thank you. But yeah, there are things that I want to discuss in the future that I think might be interesting that are, I don't think, like, not like inappropriate for sister space, but just like, I don't know, things that like are more like specific to like medical things and stuff like that. And I also kind of want to like branch out and talk about things that are not totally related to transition stuff. Because a big thing for me that's not gendery is reproductive health care for women. And I am really glad to see now with the reversion of Roe v. Wade that more people are discussing reproductive health care. However, so many women still don't know their own anatomy. I am still currently learning about my anatomy and what it can do and what can affect it. And I think that might be something I want to talk about in the future. But also, I'm open to suggestions. So if there's something that you're like, hey, you haven't talked about this on Sister Space, and Benji hasn't talked about this, and other people I follow haven't talked about this, do you want to talk about it? Like, just let me know. Yeah. Oh, I know. I just feel like I ramble a lot and I don't want to like talk over you or like talk at you. And if it's on my channel, I can like just talk at the screen and just like keep ranting and raving, and y'all can disappear if you hate it. So well, Carol, I mean, maybe you should spend time with your wife because like you can always watch this later. Also, what kind of ice cream are you eating? Because I can't eat ice cream, but I would love something cold to eat right now. All right. So back to this screen. Oh man. I am already getting tired of seeing the word penile. Okay. Pediatric use, as we have discussed earlier, not been tested on patients 12 years or younger. Carol, go get ice cream. Like, a lot of this is repetitive. Like, just go get ice cream. Also, like, come on, you know this shit. Okay, so we're gonna go over adverse reactions. Again, like we've already discussed some of this. Be nice. That's my ear. So endocrine and urogenital adverse reactions, gynecomastia. So I'm going to Google that real quick because I do not know what it is. And I'm probably going to misspell it. There we go. I didn't even have to try to spell it. And I'm not using a VPN or like blocking any of my info. So yeah, you can see whatever you want to see. It's fine. I don't care. An increase in the amount of breast gland tissue in boys or men. Oh, okay. That makes sense. So man boobs. Nice. Okay. So, and also excessive frequency and duration of penile erections. So man boobs and boner. Oligospermia may occur in high dosages. I'm seeing something. I don't know if it still shows it for me, even if it's been blocked in the chat. Okay. Let me see. Okay, well, it looks like they've been blocked. So, mods, if you got to that, thank you very much. Oh, thank you, Benji. Appreciate it. Okay, cool. Yeah, I always think it's funny when we're doing sister space and that stuff comes up, and I'm just like, why? Like, wrong audience, my dude. All right, so skin and appendages, hirsutism, male pattern of baldness, seborrhea, and acne. Hirsutism, I don't know what that is. But male pattern of baldness. I'm not going to Google everything that I don't know right now. So I apologize. But feel free to drop the definition in the chat if you want. I am trusting you women to be able to navigate Google yourself. Oh, thank you, Lisa Michelle. I appreciate it. Hairiness. Okay. And I believe seborrhea is like excessive oil on the skin. Maybe I'm wrong. Fluid and electrolyte disturbances, retention of sodium, chloride, water, potassium, calcium, and inorganic phosphates. So that sounds like a great time. You're going to swell up like crazy. Gastrointestinal, nausea, cholestatic jaundice. Gonna look like a Simpson. Alterations in liver function tests, rarely hepatocellular neoplasms, and pileocyst hepatis. See warnings. So essentially, it could really fuck with your ability to track what's going on with your liver. Because you could be jaundiced and it will mess with the tests and you don't know what's going on. It's interesting, to say the least. I'm sorry. But you know what? Women are hairy, and that's okay because we're fucking 8 people. It's okay. We're just louder apes. Yeah, I agree. Oh, this is where it gets spicy, y'all. Hematologic adverse reactions, suppression of clotting factors 2, 5, 7, and 10. I didn't know that there were like levels, but that's the fact that there's 4 of them here. Not cool. Bleeding in patients on concomitant anticoagulant therapy and polycythemia. So clotting issues is listed here. Again, that's, to my knowledge, not commonly discussed when you see the gender doctors. I don't personally know of any women who talked to their doctor before taking testosterone, and that this was mentioned. It was not mentioned to me. But yeah, clotting issues. Nervous system, increased or decreased libido, high or low. You're either gonna be super horny or not want anyone to touch you. Headache, anxiety, depression, and generalized paresthesia. So, you're taking a drug for suicidality and depression, essentially, right? I mean, there's more to it, but essentially. And it could cause depression. Now, this is not uncommon for antidepressants like SSRIs and stuff like that to say, may worsen depression, may cause suicidal ideation, such like that. But again, I can only really work off of my experience and anecdotal evidence from people I've spoken with. But when it comes to medications that are given to treat depression that may also cause increased depression, that is discussed with your doctor. It's something where especially if you have a patient who is actively suicidal, most doctors are apprehensive, at least, about giving them a medication that's going to increase their depression. So it seems really counterintuitive to give someone who is like damn near bragging about how they want to die something that can make their depression worse. But, what the hell do I know about that? Allergic. Hypersensitivity, including skin manifestations and anaphylactoid reactions. Cool. So if you're allergic, you might die. Not like especially surprising. Vascular disorders, venous thromboembolism, miscellaneous, inflammation and pain at the site of intramuscular injection. I personally never really had much swelling that I can think of or much pain, but I did have bruising. I think what I would do is, and I apologize if this is TMI, but because I injected into my ass, into my butt cheeks, I would rotate. So I would do, one side for one dose, and the next dose I would do the other side. But I was doing it for almost 6 years. So I ended up with lots of bruising from that. And I've mentioned this before, I think in a recent Sister Space, how it's really embarrassing. I reused needles. I had some trouble for a while getting access to syringes and needles. And it was like, I had the money and stuff like that, but it was something to do with, they didn't want to make it more accessible to do intravenous drugs, I guess, which I suppose makes sense. But, I had this prescription for this intramuscular medication. So, and I couldn't refill the prescription for the needles. It's hard to explain, but it didn't work out. So I would have fresh needles. And so I ended up reusing, which is really fucking stupid. Really, really fucking stupid. It doesn't matter if you are only using it for yourself. Reusing a needle opens up the injection site that much more. It's jagged. It's not going to heal properly. It's going to be more exposed to bacteria and issues. It's such a bad idea. Do not fucking do it. I was dumb. So, yep. I would soak them in a bottle. Yeah. Stupid, really dumb, really bad. And you know what's worse is I had like taken plenty of like classes like from like provided by like nurses and stuff on how to do a safe injection, not only for myself but for others, because like a lot of trans-identified females I know, especially these days, don't inject themselves. They go to the doctor to get their injection. And yeah, like I don't know if maybe it's a generational thing or what, but yeah, at the time, like I did mine myself. I knew a lot of people who went to the doctor for it. So when they couldn't get in to see a doctor or a nurse to get their injection, they would come to me because I like knew how to do it, I guess. Still really unsafe, still really bad. I feel like shit because I did that. Like I hate that I did that, because no matter how safe I think I was, I definitely was not as safe as being in a sterile environment like a hospital. I mean, even when I was doing it like at our shot clinic, like that wasn't a hospital setting. It was cleaner than like doing it at my house, but like not great. All right, getting back to it. So yeah, under the Anabolic Steroids Control Act, because testosterone is an anabolic steroid, depot testosterone injection has been assigned to Schedule 3, also known as Substance Class Level 3. There have been no reports of acute overdosage with the androgens. So no one has taken enough testosterone to kill themselves directly. I mean, you know, you can argue that the subsequent side effects and what have you and health issues contributed to a person dying or what, you know, something to that effect. But arguably, no one has injected enough testosterone to say, you know, stop their heart right away or something to that effect. In any case, it's not been listed on any coroner's report that the person died due to overdose of testosterone. So it is for intramuscular use only. We went over that. We went over dosing. 50 to 400 milligrams should be administered every 2 to 4 weeks. How it is supplied, we've gone over that. And this is my favorite part. We are looking at Pfizer's label, everybody. Like, this is a product of Pfizer. And I am not going to even entertain any comments regarding vaccines or any of that nonsense, because I've had that discussion in far right groups. And no, I'm not talking about that. But Pfizer is a pharmaceutical company, and pharmaceutical companies want pretty much only one thing, and that is fucking money. So that being said, you know, they have kind of a monopoly. I mean, there's several companies out there, but they have kind of a monopoly. They so this was distributed originally by Pharmacia and Upjohn Company, but it was acquired by Pfizer not that long ago, as you can see. So I think, oh, excuse you. My friend, that is my neck. That is not something to pull off of me. So what was I going to say? Yeah, Pfizer essentially bought them. There was like a merger, and they bought them. And I feel like they've bought several companies over the last few years. But maybe somebody has more information on that. Do you need to go back to your home? You're getting kind of angry. Do you need to go back home? Are you just angry because of the straw? Straws are the enemy. Okay. So, sorry about that, getting distracted. That was the FDA label for Depo Testosterone. Now we're going to move on to something that I think is a little more interesting. Black box warnings and lawsuits information. Now, I used to have like a plethora of sites that I had saved concerning lawsuits involving men who had taken testosterone, like after cancer and things like that. And they had sued pharmaceutical companies and brought this issue to the FDA. I couldn't really find where I put those sites. So I'm sorry. I don't have a whole lot on this, but I did find this site in my logs. So let's talk a little bit about that. So I'm going to start a little bit further down the page. But as you'll see, this was published February 28th, 2014. Not really that long ago, considering. And just for reference, like I started taking testosterone in 2012. Yeah, 2012. So this was occurring while I was on testosterone. It was just last month that the FDA announced that it is investigating potential testosterone therapy risks. This was prompted after several studies suggested that the side effects of testosterone treatments may increase the risk of heart attacks, strokes, blood clots, and death. Pretty severe risk, considering many men taking the medication aren't even candidates for testosterone and cannot benefit from the drug. The problem. Low testosterone treatments may double the risk of a heart attack for young men with heart disease and for men 65 years of age or older, even those who have had no heart problems. That's the problem in a nutshell. Additional concerns with the products include the increased risk of DVT, deep vein thrombosis, which can lead to life-threatening complications, including pulmonary embolisms. DVT is where the body develops blood clots in the deep veins, most commonly in the legs. These blood clots can break off and travel through the body, resulting in potentially life-threatening complications. So essentially, deep vein thrombosis can turn into pulmonary embolism. Pulmonary embolism then can move to your lung, and that's where it will kill you. It can kill you if it's found in other places, but like if it travels to your lung, like that's extremely dangerous. The following products are included with those that could be causing serious and fatal injuries. Androgel by AbbVie Abbott. Where have we heard that name before? Somebody help me out. I feel like this AbbVie company, we've talked about it before, right? Maybe I'm just crazy. I don't know. Androderm from Actavis. Xyrem by Eli Lilly. Sorry. BioT-Gel by Biosanti and Teva. Deletestrel by Indivis. Depo Testosterone by Pharmacia and Upjohn Company. Once again, that company was acquired by Pfizer. Fortesta by a company named Endo. Striant by Columbia Laboratories. Testim by Xylem/GlaxoSmithKline. And Testapil by Exilium. So, just as an aside, I have been on Androgel from AbbVie and Abbott, Androderm from Actavis, BioT-Gel, mine was from Teva, Depo Testosterone, mine came from a few different companies because there's a few different companies that do Depo. And also I was on Testim. These, a lot of these are the gel form, as you'll see from things like androgel or androderm, derm skin. But I do think it's important to note, it's not just the gel. They're including the depot testosterone too. So this is an issue with the testosterone, not just like the method that it is absorbed into the body. Yes, ma'am. I have sampled. Thank you. No, for a while there, insurance was actually taking it pretty seriously about like coverage and stuff, and so like they wouldn't want to cover one brand, and so my doctor would switch me to another brand. So. Definitely the depot. Fullest body, richest notes, like a little bit of an oaky afterbirth. Yeah. Okay. That I can't say because I don't have balls because I'm not a man. So let's see. Despite the controversy, testosterone supplementation in the United States has increased substantially over the past several years. The increasing popularity of the medication is astronomical. Marketing directed toward the consumer preys on men's concern of fatigue, decreased sexual virility, and other symptoms that are common with aging. If you are over 40 and don't have these concerns, you are probably lying. Agreed. Like, I don't know. I had a conversation with a man not that long ago, and he was talking about, like, I'm sorry, it's going to be kind of nasty, but he was talking about erectile dysfunction and low testosterone, and like attributing like these mental health symptoms to it. That I was like, nah, dude, like you're just fucking depressed. Like, see a therapist maybe or something. Like, just deal with your depression. Best adult dating sites. No, thank you. All right. Thank you, mods. Let's see. These companies play on our insecurities. Weird how they were able to find humans of the opposite sex who had insecurities. I wonder if maybe women are convinced to be more insecure and then maybe more susceptible to being influenced by marketing a drug that they don't need to them. Have you seen the commercials for Androgel? I don't know if any of you have seen any of the commercials. I do remember seeing a few commercials for it though. I think it's like been off air for a long time though. I don't know, but that's just here in the US and just in like where I've lived. So maybe they're still airing somewhere. And if they are, God bless. Here's the other problem. There is little clinical evidence to suggest that the drug will provide these kinds of benefits. Many health officials worry that testosterone replacement drugs are being prescribed for men with relatively normal levels of testosterone. According to the FDA, testosterone therapy was never approved for any treatment other than that to treat men who have hypogonadism, a condition in which the male sex organs produce no or very low testosterone. 2014, women. 2014, this was published. And they are, referring to the FDA saying that this drug was only made and used to treat hypogonadism in males. This is not a condition that affects females whatsoever. There's no reason for this drug to be prescribed to females. Now, once again, off-label. Some drugs can be of use. Theoretically, testosterone has been used to treat women with breast cancer. But from what I've read, at least, it's kind of like minimal, the benefits. And it's arguably not a great option for them. But, I have a bias. So maybe there's more information out there. I don't know. Cool. If I figure out, I can't, I don't know how to add any extra mods right now, without like having a long moment of silence while I do it. So, thank you, a possible person. I will get back to you about that. Because right now I have 2 people who are on mod duty. So, okay. What does the future hold? Litigation, and more litigation. Let us hope. Let us hope. Even more so, I can only imagine now that drug manufacturer Endo Pharmaceuticals is ready to release a new long-acting testosterone injection known as Avid. The FDA is set to decide whether to approve the product in the near future. Whether that drug will add additional concerns and lawsuits to those already filed or in the works is anyone's guess, but I'd be willing to go out on a limb and say yes. If you or a loved one have taken a low testosterone supplement and experienced a heart attack, stroke, death, or any other severe side effects, you may be entitled to compensation. So, again, I apologize. I don't have the information readily available, but there have been lawsuits over this, and it's all from men, right? But if anybody is going to be listened to, it's the fucking men who are harmed, right? So I think honestly at this point, like, we really need to like just hope and pray that, God, this is horrible, but we need to hope that the men who are harmed from these drugs speak out more often, and contact people more often, because detransitioned women, like, I've talked about this so much, like, I don't want to go into it too much, but like, we can't sue. Like, it's really, really nearly impossible for us to sue, right? And I don't think there's going to be a class action soon, because there has to be other steps done before we can reach a class action. So, that's all to say, like, the men have more ground on this than we do anyway. Like, they have been the ones taking these companies to court, and like getting the research and like showing that these drugs are harmful, because the women who take this drug are like ignored or like intentionally like excluded from reports and things like that. So there's no way to really get all of the statistical data, get research done, get lawyers who have the fucking ovaries of steel to deal with this shit, and take any of these companies to court. It's going to be really, really hard. So that's my thought. Maybe others have different thoughts. But the question comes up all the time for me where people are like, why didn't you sue? Or why don't you file a lawsuit? And it's like, well, would that I could. I have spoken with lawyers before about my potential case, and every single time they're like, okay, statute of limitations is gone. You lost all your information to the statute of limitations, so you have no further evidence beyond like the last 2 years. Like, previous to that, or the last 2 years I was on testosterone, like previous to that, you don't have like your diagnosis or any of that stuff. It's all like literally been destroyed, literally was wiped from their computer system. And so the lawyers were like, well, you don't have a case. So that's just the way it is. But that's why I'm doing shit like this, because I can't get justice for myself, I guess. I don't know. I'm sure there's some sort of deep thought in that, but let's move on. If you keep biting me that hard, I'm going to put you back on your cage. Okay? Do you need to go back? Okay, let me know. All right. I want to, and I'm sorry, I'm kind of ignoring the comments a little bit. Benji is so much better at this than I am, where she will like be able to like read and highlight the comments and like all this stuff. I don't know why. I don't have ADHD. I don't have any distracting stuff going on. So I just can't do both at the same time. Yes. That's part of what I want to talk about in the future is how we can make that happen. I also want to be more vigilant about complaints to the FDA. Not that it'll do much, but just so that we can have a record of complaints to the FDA, because I think that'll help. Oh, thank you. I'm glad. I would love it if people were able to like watch this and actually learn from something. Okay, well, like some of us have a job, so, you know. Okay. Let's see. So, I'm going to X out of this so that I have more space. Oh my God, I can't believe it's 8 o'clock. Okay, I'm going to try to wrap this up soon because I'm getting tired. So I might not actually be able to make it to all of these tabs because, I mean, look at these fucking tabs. There's so many tabs. All the tabs. Informed consent. Yeah, I know. It's some bullshit, right? I know, I agree. All right. What is informed consent? So, this is from a... No, I'm kidding. Being a musician is absolutely a great career move, right? No, I'm kidding. I mean, joke's on me. I want to make movies. Like, come on. Okay, informed consent. So this is coming from a prescriber. I know, ONC. I know. I'm sorry. I did it because I didn't want to make a slideshow, and because it's easier to go through them this way instead of having like multiple windows. Because this way I could like align them based on like what I wanted to cover when. Okay. Okay, I'm gonna talk. Okay. So I'm gonna skip over her little spiel at the beginning there. What is informed consent? At its most basic level in a healthcare setting, informed consent is a legal document that is used to outline a patient's consent to have a procedure or receive a specific medication or treatment plan. By signing the informed consent document, the patient is confirming they are fully aware of all the implications of that procedure or treatment plan, as well as the risks and side effects of the taking of certain medications. Okay. No one can consent if they don't have all of the information. Informed consent is a lie. It is a published lie. You are signing your name saying that you've been told of all the risks, and that doesn't happen. You are not told of all the risks. I'm going to be bold and say that is a claim I will stand by. So yeah. It is common for patients to sign informed consent documents before undergoing surgery, or in the case of transgender patients being treated at our practice, signing informed consent before receiving hormone replacement therapy, HRT. Oh, she's gonna get in trouble. She should be calling it gender affirming therapy, right? Is that the one? I think there's probably a couple others. Yeah, I apologize for bird tweets. If it gets annoying, let me know and I'll scoot him away. But he's my comfort animal. Depending on the type of transition a patient is desiring, M to F or F to M, the informed consent will be different and will cover the hormones that will be taken during the process. For patients who identify as non-binary, we provide them with the appropriate consent based on the hormone being dosed. Because non-binary isn't a thing and you have to pick one or the other. Informed consent HRT for 18 plus patients. It is critically important to note that I can only offer informed consent for patients who are 18 years and older, since patients younger than that do not have rights to sign their own consent and must be a parent or must have a parent or legal guardian present to sign the informed consent for them. This doctor is in Atlanta. I don't know what the law is like there. Oh, I'm glad. He has lots of opinions. So, yeah. Yep. Yeah, if I think, or I like to think at least, that if I had been made aware of the higher risk of a heart disease and stroke, that I would have reconsidered at least. I don't know if I would have still not gone through it, but like, yeah, it's just, again, it's a lie. Okay. Don't inject hair gel, maybe, because that sounds painful and sticky. All right. So, yeah, at her clinic, I'm probably doxing her. I feel bad. At her clinic, they only treat patients over 18. Do you need a therapy letter before informed consent HRT? It's not uncommon for some HRT providers to prefer their patients to have a therapy letter prior to receiving transgender hormone replacement therapy. Some providers prefer to have a mental health care provider document the patient's readiness for medical transition. Other providers also utilize this approach in order to document the journey/timeline of gender incongruence. So, bearing in mind that gender incongruence can be as much as not liking to wear dresses when you are a small child, or liking Barbies if you're male. I feel like it's pretty fucking stupid to suggest that having a mental health care provider sign off on this does any sort of safeguarding. It doesn't. And you all know this, of course, that gender therapy is ludicrous. You are going in with a confirmation bias on both sides, both from the patient perspective as well as from the therapist. You're both there to meet the same goal, and you are going to move the goalposts however you need to and maneuver around whatever real issues there are in order to reach that goal. So there's really no point to it. It's just performance. So while you are not required to have a therapy letter before starting informed consent HRT at this clinic, I do recommend all of my patients see a mental health care provider, especially once they've decided to undergo hormone replacement therapy. When it comes to wanting to transition, most of my patients have felt this way for a long time. Okay, what's a long time? Is a long time 6 months? Is a long time 6 years? What's a long time? And clearly do have gender dysphoria. But mental health care is so important to help as any patient undergoes hormone replacement therapy. My background and training in psychology allows me to practice more comfortably with certain diagnostic criteria that other providers might not be as well versed in. So, she's fluent in trans, is what I'm gathering. She's fluent in trans. She knows what these people want to hear, and she's ready to give it to them. Yes, exactly. Yeah, it's very experimental. There's not really much written research, and it's weird because like pro transition people will use that like as like a positive talking point almost and be like, well, we haven't had anyone like come to us and say that their trans man friend died because of this. It's like, well, no shit, Sherlock, because again, lost a follow up. Like, especially like, if you talk to any older FTMs, like a lot of them have had like lots of health issues, and I like how do I put this? I have a lot of personal and ideological issues with older trans men, so called. However, I do have a lot of empathy for them when it comes to things like health. I wish they would understand that they are perpetuating the issue and creating more unhealthy women by even just being visible. And it sucks because it's like, I get it. They want to talk about stuff. They want to talk about what it was like for them. But at the same time, it's like, dude, you're like giving instructions. Like, stop. You're telling women how they can hurt themselves. Don't do that. So I don't know. But I would say for anyone who hasn't checked out older detransitioned women or older, so-called FTMs, I would recommend trying to watch some of it. I know that it's going to be a challenge to sit through some of it, but I think that you can glean a lot of helpful information. Also, the forums and stuff. It's so weird when I'm in spaces right now, like the spaces that I'm currently in, at least. I'm like so often like the oldest detransitioned woman. And I know that's going to change. I know that there's going to eventually be a lot more detransitioned women as time goes on. And, all that business. But I do feel like a lot of women who have detransitioned also just went quiet. Like I seriously considered it. I still think about it where I'm like, man, I wish I could stop talking about this. And I wish I could stop thinking about this. And so like, that's why I take breaks and stuff. But anyway, I'm sorry, I'm derailing myself. But that's all to say, yeah, we don't really have anything more than anecdotal evidence for anyone who's been on testosterone more than like a decade. It's just not talked about. Thank you for being on. I know that it's really, really late and yeah, you've had a really long day. And yeah, thank you for watching. You didn't have to, but I like it that you did. And I will see you tomorrow. All right. I'm gonna wrap this up. Don't worry, woman. I'm gonna wrap this up. Okay. Informed consent. So, before I even meet with a hormone replacement therapy patient for the first time, I go ahead and draft a personalized informed consent document to go over with them in person. During the initial visit, we go through the informed consent document together, allowing the patient to ask any questions they may have before signing it. I mean, I didn't know what kind of questions to ask. Even after like talking to lots and lots of women who were transitioning, I didn't know what to ask. The document lists risks, benefits, the expected time frame, and the expected physical changes of taking hormones. The document also covers the emotional changes that might occur. I would love, love, love to see to see her actual document, like to see her actual informed consent document. And to like be able to understand exactly what it is she's going through. Because I don't want to like shit talk her if she's actually like talking to them about legitimate stuff. Like I don't want to discourage that, but at the same time, it's like, you know, from everyone I've spoken to, it's like, and I've seen a lot of these documents. Like other detransition women have kept theirs and have shown me, and I'm like, cool, same shit, different day. Like, you know, you might go bald, you might have some acne. Like those are the worst things that are going to happen to you. You're not going to have a stroke. We're not even going to talk about that. You know, you're not going to possibly get cervical cancer. We're not going to talk about that. Don't worry. You know, all these things that it's like, it, like, even if the risk is so minimal, you don't think it's going to happen to your patient, like, fucking discuss it. You're talking about a lifelong medication. Like, fucking discuss it. We cannot I'm sorry, I skipped a part. Our informed consent also includes a schedule of follow-ups and blood work because it's very important that patients come in for follow-ups to make sure that there are no negative side effects occurring from the hormones. If this is true, I like this and appreciate this because follow-ups and blood work need to happen. I have my doubts because I am a pessimist, but if this is true, then I got to give that to her. We cannot, in good conscience, refill any hormones if we have not made sure that a patient's health is in good condition and that they are not suffering from any negative side effects from the hormones. Yep. Pretty much. Yeah, if you don't know what kind of questions to ask, then I mean, how are you going to ask the right questions? And you're not going to get just prompts from your doctor. They're not going to be like, "Hey, like, do you have a family history of heart attack or stroke?" Like, I don't think asks that shit. Maybe, I don't know, maybe someone can chime in, or, you know, maybe there are women out there who've been asked that by the doctors, but I certainly wasn't. I know a lot of women who were not. So, signing the informed consent HRT document. After I've gone through an informed consent document with a patient, I go ahead and leave the room and get a support staff member to come in and witness the patient's signature on the consent. This witness is simply there to verify that the patient signed the document on their own, that I didn't make them sign it or force them to sign it in any way, other than telling them they'll die without it. It's impossible to witness someone's level of comprehension of the consent, so I stress that patients that once they have signed the consent, they are confirming that they have understood all of the information on the consent form and are ready to begin treatment. You chose this. Yep. Once the patient and the witness sign the document, the informed consent demonstrates the patient's understanding of the treatment and its implications. Once the patient has signed their informed consent HRT document, we are ready to begin the medical transition. I am present with my patients along the way and available for any and all follow-up questions and concerns. The transition looks different for different people, depending on their goals. We develop an individualized HRT plan, draw blood work, and in most cases, my patient leaves with a prescription for their medications. So this sounds like it kind of happens all the same day, which would not surprise me. We ensure patients have the necessary training to administer their medication safely. This is a well-documented process, and by doing this, we can make sure the patient is supported every step of the way until they decide to stop. So, okay, I am going to stop. I know we have a fuck ton of tabs left that we have not touched, but that's okay because maybe we can do this again sometime if you're interested. I'm tired and I have sister space in the morning, so I'm gonna relax and chill the fuck out. But that being said, I think we learned some things today about the potential harms of testosterone. You know, we ended with a brief touch on informed consent. Yeah, I'll do a part two. I'm fine with that. I could talk about this for ages because it's stupid. I love stupid shit. And if you can't laugh about it and can't dissect it, you just gotta live with it. I don't want to fucking live with it. That's boring. So we're gonna laugh at it. We're gonna dissect it some more, and learn more about it. Because if we, the patients, former patients at least, and those who want to support former patients, are not well informed, then who the fuck is going to be well informed? Love chat. Fuck you. No, this is not like HBO. Not gonna happen. Sorry. But I will talk about this in another video at some point. I'm going to get some other people on board to I'm gonna get some more people on board to be mods, so hopefully you guys sorry, can be a little bit more proactive and help each other out in getting that, because that would be awesome. Yeah, I hope that you all learned some things, and if you didn't, I hope it at least was like somewhat interesting. Again, the links are in the description. Feel free to read ahead on any of this stuff. There's like a couple documents here that are like super long, so like feel free to flip through those if you want. I think there was one document that was download only that I did not include in the links, but maybe I did. Otherwise, I hope all of you women have a great morning, afternoon, or evening. I hope you're staying cool and hydrated. Deep breaths, appreciating your body, appreciating your space, appreciating bird. All right. Good night.